Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Fareha Saleem, and today the topic of our discussion is cranial nerves. So, basically, there are 12 main cranial nerves. Let's go through these nerves. We will learn today the names of these cranial nerves in sequence and their proper function, and we will learn if they are sensory or motor nerves. In the last lecture, you have covered the spinal reflexes. I hope you have gone through that lecture. And today, I would like you to listen carefully so you would not mix these nerves. The first one is olfactory nerve, which is basically a sensory nerve. And the main function of olfactory nerve is sense of smell. Second cranial nerve is optic nerve, and it is a sensory nerve which carries the signals of vision. The third nerve is oculomotor nerve, which is a motor nerve, and the most of the eye movements occur through these nerves. Fourth nerve is trochlear nerve, and it is a motor nerve which helps in eye movement. Fifth and very important nerve is trigeminal nerve, which has three main branches. We will study about it later on. And it has both sensory and motor nerve endings, and it supplies the face sensations, mastication, and it has multiple functions like it supplies the maxillary mandibular teeth and the salivary glands, which are the mandibular gland, submandibular gland, and sublingual gland. The sixth nerve is abducent nerve, and this basically supplies the lateral rectus muscle of the eye, and it has motor nerve endings. Seventh and again very important nerve is facial nerve, which has both sensory and motor nerve endings, and the function is that it supplies the facial expression like frowning, smiling, and a wicked expression, sad face, and these all you can say the facial expressions are provided by the facial nerve, and it also supplies the taste sensation. Now, the seventh nerve is the vestibulocochlear nerve, which supplies the organ of ear, and it has sensory sensations, and it is important for hearing and balance. The vestibular part is important for balance, and the cochlear end is present in the organ of corti, which helps in hearing. The ninth nerve is glossopharyngeal nerve, which has both sensory and motor nerve endings, and it is important for taste and gag reflex, and it also supplies the muscles of tongue. 10th cranial nerve is termed as vagus nerve, and it has again both sensory and motor nerve endings, and its motor part supplies almost all of the main organs of our body, starting from the carotid sinus to the heart, then the small intestine, stomach, and ureters, kidney. um, and again its sensory supply is to the all the mucous membranes of these organs, and the function is that it is important for gag reflex and the parasympathetic innervation. The 11th nerve is accessory nerve, which is a motor nerve, and it is basically important for shoulder shrug because it supplies the sternocleidomastoid muscle, which is present in the neck region, and trapezius muscle, which is present in the shoulder region at the back side. So this muscle helps in the shrugging. 12th cranial nerve is hypoglossal nerve, and this is a motor nerve. It has motor nerve endings, and the function is swallowing and speech. So you have to memorize the names of these cranial nerves in sequence. First one is olfactory, second is optic, third one is oculomotor, fourth is trochlear, fifth is trigeminal, sixth nerve is abducent, seventh is facial, eighth is vestibulocochlear, ninth is glossopharyngeal, then we have vagus, 11th is accessory, and then hypoglossal. Now we will study these nerves in detail. The first one is olfactory nerve, which we remember that it was a sensory nerve and its sense of smell. is the main function of this olfactory nerve. Okay, so the track of this nerve is not important for a physiological point of view, but I am just going to go through it very quickly. First of all, the signals go towards the olfactory receptors in the mucous membrane of nasal cavity, then to the olfactory bulb, then to the olfactory tract, and in the end, it reaches the olfactory area in the temporal lobe of cerebrum. Let's see through the diagram. First of all, the signals are received in the mucous membrane of olfactory region or the nasal cavity. Then the signals go towards the olfactory bulb area, then towards the olfactory tract, then to the fibers of olfactory nerves, and in the end it goes towards the olfactory area in the temporal lobe of cerebrum. So next we have second cranial nerve, which is optic nerve. It is a sensory nerve, and as you can see that first of all the sensory nerve endings of this nerve takes the sensation from eyeball, then it reaches the retina, then these signals are passed to the optic nerve, then to the optic chiasma. At optic chiasma, the right side of optic nerve move towards the left side and vice versa. As you can see that there is a cross at optic chiasma. Then it continues to the optic tract, and later on it relays into the lateral geniculate nucleus of thalamus. After that, it moves towards the optic radiation and finally to the visual cortex, where the image is produced and it is visualized from our eyes. The third cranial nerve is oculomotor nerve, which is a motor nerve. It basically supplies most of the muscles of our eye. Only two muscles are not supplied by this third nerve. Let me tell you a formula for that. LR6SO4. LR6SO4. Lateral rectus, there are basically superior rectus, inferior rectus, lateral rectus. These are the muscles of eye. Then superior oblique and inferior oblique muscle. So eye movement occurs with the help of these muscles: superior oblique, inferior oblique, lateral rectus, superior rectus, inferior rectus muscle. So the lateral rectus is supplied by sixth cranial nerve, which we will study later on. The superior oblique muscle is supplied by the fourth cranial nerve, that is trochlear nerve, which we are going to study. Rest of all the muscles are supplied by third cranial nerve, which includes superior, medial and inferior rectus of eye and inferior oblique muscle and ciliary muscles. All these muscles are supplied by third cranial nerve. You have to remember this formula: LR6SO4R3. Okay, LR6 means lateral rectus is supplied by sixth cranial nerve, superior oblique is supplied by fourth cranial nerve, and rest of all the muscles are supplied by third cranial nerve, which is oculomotor nerve. And again I'm going to repeat that it basically supplies the superior rectus of the eye, inferior rectus, medial rectus and inferior oblique muscle and ciliary muscles. Okay, let's come back to the fourth cranial nerve, which is trochlear nerve. Trochlear nerve is a motor nerve. Okay, so it arises from the nuclei in the midbrain near the cerebral aqueduct. It supplies the superior oblique muscles of the eye. I just told you SO4 means superior oblique muscle is supplied by fourth cranial nerve, that is trochlear nerve. Now we come to a very important and the largest cranial nerve, that is trigeminal nerve. It is a mixed nerve. Mixed nerve means it has both sensory and motor nerve endings. It is the chief sensory nerve for face and head region, and it is really important for mastication purpose, that is chewing purpose, because it supplies all the muscles of mastication, okay, which includes the buccinator muscle, masseter muscle. There are multiple muscles which are involved in mastication. So let's just overview the three major divisions of trigeminal nerve. First one is olfactory nerve, this one. Second is maxillary nerve, and third is mandibular nerve. As the name indicates, olfactory division is supplying this part, maxillary nerve is supplying this area, and mandibular region is supplying this area. So olfactory division is supplying the senses of this temporal and frontal region. Maxillary division is supplying all the maxillary teeth, the palate area. Mandibular division is supplying the mandibular teeth, that is the lower teeth, and the tongue region, slightly the lower floor of the tongue region, and the glands. The olfactory division, the senses are taken towards the olfactory nerve area, then to the trigeminal ganglion, and later on to the mesencephalic nucleus. The maxillary division carries the sensation towards the maxillary nerve. Again, it relays into the trigeminal ganglion and later passes to the main sensory nucleus. The mandibular division senses are taken to the mandibular nerve, then again to the trigeminal ganglion, and later into the spinal nucleus. So you have to remember that trigeminal nerve has three main branches: ophthalmic division, the maxillary division, and the mandibular division. And these three divisions are supplying maximum area of our face and head region. So it is a very important nerve. So now we come to the sixth nerve, that is abducent nerve. And if you remember, I told you that the formula was LR6, which means that lateral rectus of the eye is supplied by sixth cranial nerve, that is abducent nerve. Okay, and the nuclei of this nerve are present under the floor of fourth ventricle, which is present in the brain. This nerve is motor nerve, that is, it carries the motor sensations only. Sensory sensations are not carried by this nerve. Next, we have facial nerve, which is a mixed nerve, that is, it has both sensory and motor nerve endings. Its nuclei are present in the lower part of pons, and the motor sensations basically they carry the facial expression. Okay, so muscles of facial expressions are supplied by the seventh cranial nerve, which is facial nerve. For example, frowning, blowing your mouth, blowing the whistle, pouting, or big smile, okay, or shutting down your eyes or looking at the roof. All of these expressions, they are because of facial nerve. Any person who has this nerve damaged, they can't smile properly, they can't frown properly, they can't blow the whistle. Okay, so these are some tests which we do to check the proper functioning of this nerve. The sensory signals from facial nerve are basically taken from the anterior two-thirds of the tongue. It carries the taste sensation. Next, we have eighth nerve, which is vestibulocochlear or sensory nerve. It has two parts. The first one is vestibular nerve part, or the second one is cochlear part. Okay. So the vestibular part arises from the semicircular canals of the inner eye and convey impulses to the cerebellum, and it helps maintain the posture and balance. Okay, so the vestibular part arises from these three semicircular canals, and then the impulses are taken to the cerebellum, and the function of vestibular apparatus is to maintain posture and balance. And basically there is fluid present in these semicircular canals. If there is some imbalance in this fluid, if the fluid is reduced, or if the fluid consistency is changed, or if the fluid content is increased, then the person's balance is disturbed. The person is not able to walk in a straight line. They wobble towards right or left side. Next, we have the cochlear part. As the name of the nerve indicate, vestibulocochlear. So, the cochlear part is present in the organ of corti, in the inner ear, and it is involved in the sound perception. So, you must remember that our ear is capable of two main functions in our body. The first one is hearing, and the second one is balance. Okay? And this nerve is sensory nerve, that is, it carries the sensory sensations only. Ninth nerve is the glossopharyngeal nerve, which is a mixed nerve, and the nuclei is present in the medulla oblongata. Its motor region carries the muscles of the tongue and the pharynx and parotid glands. Sensory sensations are taken from the posterior third of the tongue and pharynx. It is really important for swallowing and gag reflex. Okay, so please remember that for every nerve, you should remember at least 2 to 3 functions of that nerve. And you must remember that either that nerve is sensory or motor or mixed. These points are very important for your SCQ and MCQ point of view. Ninth nerve is vagus nerve, and it is a mixed nerve. It carries both sensory and motor nerve fibers. And I've already told you that its motor supply is to most of the organs of our body, including glands of the pharynx, larynx, trachea, bronchi, heart, carotid body, esophagus, stomach, intestine, exocrine pancreas, gallbladder, bile duct, spleen, kidneys, ureter, blood vessels, and blood vessels in the thoracic and abdominal cavities. Okay, so the sensory supply of this nerve is from the membrane lining of all the above mentioned structures. 11th nerve is accessory nerve, which is a motor nerve, and its nucleus is in medulla oblongata and spinal cord, and it supplies the sternocleidomastoid and trapezius muscle. That is why the shrugging of the shoulder indicates that the accessory nerve is patent, it is not damaged. So for every nerve we have different you can say tests to check the viability of that nerve, and in the case of accessory nerve we check the shrugging of the shoulder. If the person is unable to shrug properly on both sides, it means that the 11th cranial nerve is somehow damaged. The last cranial nerve is hypoglossal nerve, and it is a motor nerve. It supplies muscles of the tongue, and it is important for swallowing and speech. The nucleus of 12th nerve is in medulla oblongata. So let's just overview it real quickly. Olfactory nerve is important for smell. Optic nerve is important for sense of vision. For eye movement, third cranial nerve, oculomotor, is important. Trochlear nerve is involved in eye movement, that is SO4, if you can recall, superior oblique muscle. Trigeminal nerve had 3 nerve endings, ophthalmic, maxillary, and mandibular, supplying its consequent regions. Sixth nerve is abducent nerve, which is important for lateral rectus, LR6, or muscle of the eye. Seventh nerve is facial nerve, which is involved in facial expression and taste. Eighth nerve is there is a mistake in this part. It is the eighth nerve, which is vestibulocochlear nerve, and it is important in hearing and balance as it has two parts, vestibular and cochlear region. Ninth nerve is glossopharyngeal nerve, which is important for taste and gag reflex, and it also supplies the tongue region. 10th nerve is the vagus nerve, which supplies almost all the organs of our body like esophagus, small intestine, heart, etc. And the sensory region is to the mucous membrane of all these organs. 11th nerve is accessory nerve, which is important for the shoulder shrugging as it supplies the sternocleidomastoid and trapezius muscle. 12th nerve is hypoglossal nerve, which is important for swallowing and speech. So I hope you can understand the basic concept of these nerves, and if they are, what is the nerve type, and you have to remember that what is the major function of these nerves. That is all for today.